It's about the technician, the quality of training. So I have had over the years medical estheticians with 18 years of experience, not as good as another medical esthetician with 3 years of experience who worked in a dermatology office.
Wow.
So So it's not only the number of years of experience that the technology that the technician has, it's the quality of experience that the technician
And it's
has.
also knowing the machinery, isn't it? Because the machinery changes a lot. The machines are new ones are coming up and you have to
Yeah,
practice and you have to know, for instance, the depth of the needles to use on a particular machine, like how far you
yeah.
can go down before you damage the underlying
The
skin.
skin, that's
Yeah.
right. There's another thing is the quality of the technology that you have. There are some platforms from overseas that you can get that are not Health Canada approved and that are very dangerous for the patients because they don't have the same, quality control.
Quality,
They
yeah.
don't have the same, it's not the same. Then there's aesthetics platform, which are for estheticians. And then there are some medical platforms which are reserved for, the dermatologists, people who have like physicians, people who have a medical director, and we're able to get better results with a medical grade laser than we are with an aesthetic grade laser. But there's also working with medical grade lasers also has a highest chance of things going wrong, which is why you really want to know what you're doing.
Oh,
So
absolutely.
from clinic A to clinic B, it could be the technician, the amount of years that they've had behind their belt, but also the quality of the years that they have behind their belts, the quality of the platforms that they have access to, the protocols as well. So even within the same clinic, having access to the same products, the same bag bar product, the same technology, sometimes you have technicians that get better results than others.
Wow. So how do you
Yes.
know? How does someone know? Like, how do they know where to
There's
go?
there's a lot. So what helps me is my background in science. I'm going
Mhm.
to tell you, I use it every day. People say, "Oh my God, you're a microbiologist in skin. What are you doing?" I'm like, "No,
Absolutely.
I
That's a big calling card.
it's a big exactly. I'm like, no, no, no. I
Yeah.
know. So there's also like your education. Of course, that's going to go and play a role. But what you try to do is to develop protocols that are standardized and teach the girls and the technicians, male or female, or to actually perform the same treatment. But there's always going to be like everybody kind of sees different things or has
Right.
a different approach. So there's a lot of, there's the experience, but after 10,000 hours of doing something over and over and over again, you become an expert at something.
Do you
But
practice on
no,
yourself?
not for lasers. It's too dangerous for eyes.
But you can do other you've tried the others because I love when doctors and estheticians and clinicians try stuff on themselves. They go, I know I did it myself, but I like I go to somebody in Vancouver and he's tried different things on himself all the time. And I'm like,
Yeah.
oh, because
I
I
mean,
don't like that one.
every time I bring a product or I bring a product line or I bring a new treatment to the market, I will 100% have it try on myself first
Hmm.
because I need to develop a protocol that's going to be optimal for healing and how we do things. So you could have a laser from Cutera and the same laser, two different technicians and completely different outcomes. So the way that you work the laser as well, there's a big part that's based on experience. Like you can't quite explain it, but it's like that this is the right thing to do.
Well, I'll give you an example. I had probably 12 years ago, I had somebody in Vancouver. I've never been back to this clinic again. Do a fractional. My neck has always been the thing that I'm the most like my neck. I'm a thin person and my neck just
Mhm.
looks like it doesn't belong on my body sometimes. But anyway, I had him do a fractional.
Right.
He suggested to do the fractional and he did that on my neck And I'm telling you, Marie, it took over a year for my neck not to be red. It was almost blistering. All the lines like that were here were so much more red, that it was so red, but those were tomato red. And I don't
Mm.
know it, and it was so painful looking, and it felt painful. And I remember all I did was want to wear turtlenecks because that it was so damaged, and it took that long of just slathering on like healing ointments. And I mean, and there was, they said I over it, I that I reacted to it. It was more my reaction to it. I thought I called BS on that. I think he had it too high. He did something. My skin was, I don't know. So I never went back and don't know. But again, it's an example of somebody who may have had it up too high, or didn't realize that the skin on the neck is much more sensitive than possibly the skin elsewhere.
Yeah. So there's a lot to consider in that. And I'm not saying yes, he went too strong. I'm not saying because I haven't seen your chart.
Mm-hmm.
I don't
Right.
know, even I don't know how the platform was calibrated.
Mm-hmm.
Even two platforms that are even two Morpheus 8 platforms
Right.
will be calibrated differently. So what works at 10 joules here
Mm-hmm.
might be over treated at 8 joules over there.
Right.
It's just there's the calibration. Did the doctor had their Fraxel calibrated, their lasers calibrated? It needs to be calibrated every year. Maybe the calibration was off. I don't know. The skin on the neck, we always need to drop the energy level by about 20%. And then
Right.
you
Because
start.
it's so much more delicate.
Exactly. So very often, like you'll almost be able to do like a little bit of an overlap on the face, on the neck, first treatment, less is more, no overlap, no overtreating, especially that you said, Marie, I have really thin skin. So this is
Yeah.
another thing you need to
Yeah.
take a look at.
Right.
Is like what's the thickness of the skin, but also are there any colors to the skin? What's the amount of sun damage? Some people have a lot of browns, they have the melasma that goes down here,
Mm-hmm.
or they have a lot of because they have a lot of sun exposure, they have a lot of broken capillaries. And
Right. Right.
when you put a laser on the skin, you need to take into consideration that the skin is going to be thinner. It's going to be more reactive. Okay. It's going to be like, what about, is it very, very sun damage? Is it very, there's so many things to take care of. And then there's another thing is, were you on antibiotics when you started? Did you use Retin-A on your neck the night before and the 5 previous nights before? Were you recently sick? Were you like, there's a lot of things that you need to ask in
Mm-hmm.
order but you always, the first treatment, you always start lower. The other thing that I think is really underappreciated in our industry is the importance of the quality of the post care.
Oh, that's very important. Yeah.
Okay. So a lot
Yeah.
of people will say, oh, you just had microneedling. Yeah, just put Vaseline on, you're fine. And I'm
Mm-hmm.
like, well, no. We need some growth factors. We need some exosomes. We need a skin healing cream. We need a Hail Derma, like the
Yeah.
HOCl that we
Yeah.
hear about everywhere. We need
Mm.
that as well in order to minimize. It's not only Vaseline. I'm sorry. Vaseline is like, it's a way to heal that has worked very well in the past, but it's like 1980s called, they want their Vaseline back.
Yeah.
There are some things that you can do now that are more proactive and that are going to give you better results than, you know,
So,
um,
so really do your homework as a consumer before you go, and make sure that you ask about post
yeah,
procedure.
yeah. And you know what? Another thing is it's easy to be the hero when everything is going well. But when the manure hits the revolving fan, what
Yeah.
are you going to do?
Yeah.
What are you going to do? Is your post treatment clear? Outside of business hours, who can I reach out if I have questions or if I feel like I'm starting to get like some blisters because there's been too much energy delivered? Where do I go? Who do I call? Who can help? What are you going to do? What are you
Yeah.
going to do if you overtreat? What's the protocol here? And I would say the majority of clinics out there do not have a protocol for when things go wrong. When you do a treatment, any treatment, okay? any treatment, Morpheus, chemical peels, facials, lasers, anything, you're going to have 96% of patients who are going to see positive results. Okay. At
That's
different levels, some
yeah,
people it's going to be 10%, other people it's going to be 90% improvement. You're going to have 96% of patients who are going to see a positive result. You are going to have 3% that are non-responders.
non-responders. Interesting.
Non-responders didn't change. I did the laser, we take before and afters, nothing changed. You're going to
Interesting.
have you're going to have 3% of the population that are going to be non-responders. So you got to manage that in the informed consent. Okay? And
Mhm.
then you're going to have 1% of the clients that have a negative effect. So you're trying to treat wrinkles, and that 1% is going to have more wrinkles after than before. So you got the positive treatment outcome, you got the neutral. They're not responding to that particular technology, but there's always a small percentage of the population that they're not non-responders. They're
Right.
negative responders, so it's going to get worse. You
Well, it's
try to
interesting
treat.
too because a lot of these treatments you have to come back 3, 4 times, and I think some people don't think, oh, that's just a money grab. But when you think about it, it's because you can't go full throttle. If you said, okay, it's a one and done treatment, you probably are going to burn the shit out of somebody's face, or you're probably going to do. It's going to have to be so severe in order to get those results that they
Yeah,
want,
yeah,
and so you have to take probably these little increments of maybe raising the bar slightly each time they come back, or doing it over and over again will get them
yeah,
the results they need. So it's very important
you got it.
technically that you do it that way.
Yeah, and you know what? If somebody comes to me and says, Marie, my daughter is graduating next month and I need to look 20 years younger
Mm-hmm.
in one treatment, I'm going to say no.
Can't do
Like
it.
you cannot do it. Collagen production and improving like fine lines and wrinkles and
Mhm.
texture and everything, it takes months. Like if
Yeah, it
someone
takes a
comes
long
in,
time.
it takes a long time. It's a process. It's a process. I
Yeah.
did an erbium laser this morning on a lovely lady who's in her 60s, and I said,
Mhm.
let's book a follow-up appointment for in 3 months so that we can see the results from today's treatment. It takes a long time to build collagen. It's not an on and off switch.
Everybody wants the fix, the quick
Ev-
fix, right? The
Everybody
miracle.
wants.
Yeah. Okay,
Mhm.
so here is some of the questions I want to ask you. Exome serum, exome treatment. What do you say about that? Exosome.
Ex- Exosomes.
Hmm.
I love exosomes. We've been using exosomes at Skin Science for over 3 years. Not all exosomes are created equal, and we need to be careful about the source of exosome that we use because exosomes are made with the capsule. The exosomes are made with something that's called a messenger RNA, which in the right, the perfect how can I say that the perfect storm can actually they're believed that they might be changing some of the gene expression, so we need to be really careful about that.
So can you
So
explain just quickly what exosomes are, so for people who
yes,
don't know what they are?
so exosomes are like little shuttles. They're little shuttles that contain active ingredients, whatever active ingredients you want to put in there. Right now, exosomes here in our industry are containing different types of growth factors and cytokines and different types of anti-aging peptides and everything. But it's basically exosomes it's like the capsules, it's the carrier that are going to carry the active ingredients deeper into the skin.
And do you transport those via um, microneedling? Is that how,
You can,
or
yeah, you
through
can.
injectables or injections, or
So legally, we cannot inject exosomes in Canada.
I see. Okay.
Okay. Exosomes in Canada, the ones that are approved by Health Canada are meant to be used topically only.
Okay.
So what you can do is just like you said, create a channel. either by microneedling or, semi-resurfacing lasers or fractional or yet to get them to go deeper into the skin. But the exosomes are so small that even some, even if you apply the exosomes after, after, let's say, an IPL, which is non-resurfacing, you're still going to see an improvement in the collagen building of the skin. Maybe not
Oh,
as much as,
wow.
yeah, maybe not as much as if you had done, like a microneedling and really push those in, right? But you're still going to see exosomes are so small and growth
And can
factors
you
are
get
so
those
small.
in a serum form, like to use at night?
Yes, you can, but once again, they're not all created equal because exosomes and growth factors, for example, they are so difficult to stabilize. So if it gets too hot, they denature, so they're not active anymore. Do you reconstitute them at the last minute? So it's kind of it's really hard to find right now a good exosome company because it's kind of the far west out there when it
Oh,
comes to
wow.
exosomes, and right? Their mechanism of action is not fully understood. So it's still a little bit of a gray area. So until we know more, Health Canada has preferred to kind of, pull out of the human exosomes and say,
Mhm.
listen, we're going to approve plant-based exosomes, we're going to approve synthetic exosomes, but for human exosomes, we're going to hold off until we know more. Whereas in the United States, it is my understanding that there is a lot of human exosomes on the market.
Beef tallow moisturizer. Yes or no?
Uh, I'm not a big fan of beef tallow because it's pure oils, and pure oils tend to dehydrate the skin, but they also tend to clog pores.
Okay.
So I'm not so concerned if someone from Vancouver, which is really humid, right? Like it's really
Mhm.
humid in Vancouver, if they use beef tallow and they're not prone to congestion or they're not prone to acne, I'm not as worried about that as someone who comes here and who lives in Calgary, which is so dry.
Right.
There's already no moisture in the air. If you put oil on your face, it's going to be even worse. And then if it clogs your pores, then it leads to this whole, congestion, and then for every clogged pore you have is a future pimple, and it's like it's just.
Oh, yeah, I couldn't do that. Plus, by the way, it smells so bad. Have you smelled
Oh,
it
does
before?
it?
Oh, Lord in heaven. You cannot,
No.
it's like, no, it's a no for me.
Yeah.
No. Um, okay, so what about scar tape? People are talking all over the internet about scar tape.
Yeah, I
Yeah.
think the jury, yeah, the jury, I'm like, no, I mean, meh. Um, I think the jury is still out on that, the scar tape. Yeah, I haven't seen like
I mean,
great
there are women on the internet, young girls
science
who
behind it.
they go to bed with like all these things on their faces, then they're covering their mouth, the scar tape, all the creams, and
Yeah,
then they put like stuff like a wrap around here. They have the castor oil on their stomach. It's just
yeah.
so they call it shredding in the morning. When you get up in the morning, you have to shred all this stuff. I mean, can you imagine? Like I was, how would you sleep at night? Then you got these crazy things in your hair so that you can curl that in the middle. I was like, I would never be able to sleep.
It's a full-time job.
I mean,
It's a
sleep
full-time
is
job. You
important.
know, that being said, I'm reading a book right now that's called Breath, and that really is showing like the not the importance, but the value of being a nose breather as opposed to a mouth breather. And it's very interesting. People who mouth breathe are not as healthy as people who breathe through their nose. So the taping of the mouth at night, I totally get it. It's actually
Oh,
published.
that's
It's
why they're doing it. Yeah, I guess that's why
yes.
they're doing it.
Yeah. And in that book, Breath, like he goes like 2 weeks with, everything, like just being a mouth breather. And you see his blood work and
Interesting.
his health just goes down. And then he does a total reset. And then he does exactly the same protocols,
Oh my
exercise,
gosh. See,
food,
I'm a
same
nose
food, same
breather.
food.
I don't breathe out of my mouth unless I have like clogged up. I can't like breathe. But yeah,
That's right. That's right. But
yeah.
it's really important. Like if you take a look at it, like it really, like being a nose breather really has advantages over being a mouth breather,
Oh, wow.
even
Because
with your
the
teeth.
yeah. Oh, really? Well, and then the little nose hairs are supposed to help keep out stuff. Although I know girls that use the nose thing and they have no nose hairs, you know.
Where are we going? Where are we like
Where
where is
are
this
we
world
going?
going?
That's what I'm trying to say. Like, it's so confusing. It's very confusing for people. Um, so that's what, so I just kind of wanted to ask you, like, okay, so what about at the skincare clinic? When you, do you love PRP? Do you love, like, what do you really notice? Like, if people were going to, let's say they didn't have a lot of money, they just wanted to do one or two treatments to start. And I mean, what would you say? They just have wrinkles. They want to clean their skin up, less
Yeah.
wrinkles, clumps of
So
skin. What would you say?
so you know what? It's the little treatment that could. And the little treatment that could is microneedling.
Microneedling.
Microneedling, when it's well done and when it's paired with growth factors, the growth factors that I use are anti-age. I don't know if you've heard about of them.
No.
They are, from my research and my hands-on research, they are the best growth factors in the industry. And it's called Anti-Age MD, and they're a company based out of California. If someone says, Marie, I have $1,000 to spend. What is the best bang for my buck? I'm going to sign them up for 3 microneedlings spaced 4 to 6 weeks apart with the use of growth factors. And I'm going to sell them the little post treatment kit because remember, post treatment is really important as well to maximize the results. Not only Vaseline, it's not only coconut oil. Don't do that. And then, so
Don't
what
do beef
happened?
tallow.
And
Don't do
don't
beef
do, oh my God, don't do the beef tallow, please. And so that's what I would do. If you have $1,000 to spend somewhere, I'm going to take some before and afters, but I'm going to recommend 3 microneedling with growth factors, not exosomes. Exosomes are more expensive, but 3 microneedling with growth factors. It gives me better results than microneedling with hyaluronic acid because
Wow.
there's a,
Does that take the place of the what we used to call the vampire facial? Is that it's so that's PRP where you're taking your own
that's
blood?
right. So this is different. Okay.
Okay.
So this is different. And I personally am not a big fan of PRP for the face. I'm going to tell you why.
Yeah, I want to know.
Because the quality of the juice that you extract is only as good as the quality of the blood of the donor.
Ah,
So if the donor is old, if the donor has inflammatory conditions, if they don't have a good lifestyle, if they drink too much alcohol, if they eat like ultra processed food, if they don't take their vitamins, they don't have a good hygiene, like a life hygiene in general. What you are going to get in the PRP is going to be highly inflammatory.
oh my
So
gosh.
when you do a
Yeah.
microneedling and you reintroduce an inflammatory blend, it's very counterproductive based on the conversation we had about an hour ago, a year ago. I feel like I've known you forever, but about an hour ago
Yeah,
about how do we mitigate the inflammation. We want to have
right.
enough, but not too much. So if I take PRP and I reintroduce it to the face, if I'm reintroducing an inflammatory blend, it doesn't make any sense. So
Very well said. Yeah.
optimally, it's your 22-year-old woman that's reached a peak of her youthfulness that would do PRP that have the best,
Quality.
with clean lifestyle, clean
Yeah.
food, no processed food, whole food, lots of water, lots of no alcohol, sleep, everything. Like that person would be the perfect candidate. But at 22 years old, you don't need PRP.
There you
You
go. Yeah.
you need PRP when you're like 45 and 50 and 60 years old. But
Yeah.
then your PRP, your juice is inflammatory. So this is why I
Too
prefer
bad we
to
can't use
use.
the 22-year-olds
Oh,
PRP for.
no, 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 you can't. You can't.
I
You
know
can't
you can't,
because
but boy, that would be great if you could just switch it over. Give me a little bit of that.
so
Um,
this is why I always prefer to use exosomes and to use growth factors.
Exosomes and growth factors. Okay, I've not tried that,
Mhm,
and I can't wait to try that.
mhm.
What about the RF, microneedling RF?
Yes, RF microneedling, like Morpheus, for example, or Potenza, or Fractora. Um, it's for certain people. I think it can work well if you have a good protocol, if you don't overtreat the skin, because then you can destroy the collagen. If you overtreat the skin, you can destroy the collagen. You can have an impact on the fat,
I was going to say the
layer as
sub-Q
well.
fat can also, I've read, can
Yeah,
be destroyed
yeah.
if you.
And this is a big problem, because if you put an RF microneedling into trained hands that don't have a lot of knowledge, like I've been doing Morpheus 8 since, or Fractora, since 2011, and I can tell
Wow.
you that. So it's been like 14 years that I've been doing RF microneedling, and I can guarantee to you, Mary, that as I got more and more experience and thousands of treatments behind my belt, my approach changed.
Really?
Yes. I would rather do, because there's different ways that you can work, right, with a Morpheus. So a lot of people say, okay, Morpheus, I'll put it 2 millimeters and they do the whole
Mhm.
face. And so I have found better results when I change the depth of my needles based on what I want to accomplish and based on the thickness of the skin. But also I can tweak the energy level, right? So I'm going to go less, with less energy on the forehead, because there's no meat there and it's quite
Right,
thin.
right.
I can go higher here because it's thicker, but I
Hmm.
also need to be careful not to fry the fat underneath, because then I'm going to get lax skin. So I've actually really seen a lot of disastrous Morpheus 8 treatment that we've had, that came to Skin Science, and that we've had to correct, because there's a lot of technicians out there who don't necessarily know what they're doing, and they just kind of apply like a blank slate, like it's okay, we're going to do this at 43 millimeters deep, 40 joules per centimeter square. There's a lot of things that you can manipulate in your treatment, the energy level, the overlap, right? You
Right.
can single pulse, you can double pulse. So there's a lot of things that you can do, but it needs to be customized. And I would tell you that in 95% of cases, the Morpheus is not customized.
See, and that's scary.
Yes.
Really, again, it's back to the patient doing their homework. Because
Mhm.
for things like Morpheus 8, things that are more invasive, things that
Mhm.
could alter
Mhm.
um, inside, right,
You
of
could
your skin
scar.
or scar. Yeah. So that kind of
Yeah.
stuff. Yeah. I mean, that's why I love that you talk about the microneedling, because I think it's really well tested. I mean, obviously, somebody comes into you, you would suggest, because you're a very knowledgeable practitioner that has done this for a very long time, and
Mhm.
and this is your clinic, and I'm sure that there are reasons for people to use Moxie. There's reasons for people to use RF that you think
Mhm.
would benefit from it. But again, it's back to being finding a place that you feel comfortable, and that you believe that technician knows what they're talking about and has
Yes, and
some
then
knowledge of those
and
machines.
the knowledge, but also, are they recommending something because it's the only thing they have,
Oh, that's interesting.
right? So
Yeah.
if I want skin tightening,
Hmm.
and the person needs a Morpheus, but in my clinic I only have an IPL, what am I going to recommend?
You're going to recommend the IPL.
That's right.
Yeah.
So, and this is a problem, right?
Yeah.
It's a problem. So it's a luxury, like here at Skin Science, to be able to have a lot of different technologies that I believe are really kind of top of the line medical, but also be able to say, hey, I've got 10 different technologies here. You want to do IPL? I have an IPL here. I could do an IPL for you for
Hmm.
$395,
Hmm.
but I don't think that's what you need. I would rather, if you have $395, I would rather do a micro needling with growth factors, you're going to get better results with a series of three than with a series of three IPL,
Yeah,
Lumeca, for example.
right.
So it's also you need to choose there's the experience, but there's also what technology do you have? If you only have facials, dermaplaning, and chemical peels,
Then that's what you're going to choose from.
then that's what you're going to choose from. So there's also that
Right.
bias
Right.
of, I'd love to help you more on your fine that inside, like that little voice. Okay, well, she really needs like a Morpheus 8, but I only have microneedling. So let's do microneedling.
Yeah. Yeah. I mean, I think people just have to do their homework. As far as your clinic goes in skin science, you have some of your own products that you obviously, because you're a microbiologist, what kind of products do you have? Like, can people order your products if they can't come to your clinic? Like, I would love to see what kind of products you have, and so that maybe I would love to start on some of your products.
Oh,
Like,
I
I
would love
because
I
you
would
don't
love to send
know
you some.
where
Yeah.
to where to even start on some of these. I mean, where to get
Mm.
products like SkinCeuticals. You mentioned the C for elect. I guess they're. I just read somewhere that they are discontinuing it. Believe it or not.
No,
Yeah, I
no,
guess
that's not possible.
I think
That's
they
not
said
possible.
because the price point is too high, and the Korean skincare, a lot of skincare now are doing vitamin C, and they're having a hard time selling it at that price point that it's always been over $100 or something.
So,
So
so I have not heard that.
check it out. I could be
The
wrong, but I did read
what
that.
what I read recently is that SkinCeutical lost the patent.
Oh, interesting. Okay.
Okay. So they made the formula and then, they have the patent for X amount of years. I don't know if it's 15 or 20 or 25. And after 25 years or whatever, the patent runs out and then other companies can replicate the formula without being sued.
Oh, okay.
So there's that. Now, if you tell me that if it is true that they are discontinuing SkinCeuticals, which now I think we have to sell for like $220, which is,
It's
I
expensive.
it's hugely expensive. Okay,
Mhm.
I mean, it's great. It's a great vitamin C product, but I can find equally good vitamin C products for 185.
And again, I was going to ask you about Korean skincare because everybody's
Yeah,
talking about Korean skincare and how
yeah.
inexpensive it is, but so effective, and that they're on this cutting edge of skincare, unlike North America.
Mhm.
Um,
I think
hence
that I
the
think the
salmon
Koreans,
cream.
yes, I think the Koreans have the right approach in the sense that they are very good at hydration. They're very anti-inflammatory. There are some Korean facials now that include the PDRN, which is fragmented DNA that leads to more collagen production. And I think the Koreans are onto something, especially in terms of not like anti-inflammatory. Like it's not,
So yeah,
it's completely different than what we have on the market here. And we need to stop overdoing things with our skin because it doesn't look good.
it
You
doesn't
know,
look good.
it doesn't look good. If you overdo laser, you're going to look like a ghost. If you overdo Botox and fillers, you're going to look like pillow face. If you overdo microneedling, like you're going to start like we just everything in moderation, but also customized to you and what works for your neighbor here at Skin Science is going to be completely different than what works for you.
Okay, well, I'm going to put up for everybody so that they know how, if they want to come visit
Yes.
you in
Mhm.
Calgary,
Mhm.
or if they want to know what kind of skin products you have, because we know that you're
Mhm.
developing them yourself, which I think is
Right.
such a massive selling point, that
Yeah.
it's not mass produced,
Yeah.
that you are actually hands on developing these as a biochemist. I
Yeah,
think it's cool.
it's quite wonderful. And another thing that I've realized over the years is not all medical grade lines are created equal. That's another thing that people don't know. They think, okay, medical grade is superior. In
Right.
a lot of instances, it is, but even within the realm of medical grade, they're not all created equal. And I really truly believe that Aliquot Skin, my own skincare line, is one of the best medical grade skincare lines out there.
Really? Okay, well, I
Yeah,
cannot wait to try it. I cannot wait to try it. I'm not
I'll
re- I
send
don't
you some.
Oh, I would love that, Marie. Thank
Yeah,
you.
of
And then I'll
course,
tell
of
everybody
course.
how what I've got, and I'll show everybody on Instagram too.
Would
What
love it.
you sent. I'll try it. I love trying new products, and I don't overdo the products. I
Mhm.
like to really take the time to really try a product and know if it's making a difference. But
That's
thank you
awesome.
so much for being on this podcast. I've loved our entire conversation. Thank you so much for your information and all of your knowledge. And I'll put on the screen anybody who wants to come to see you personally or check out your products.
It's called Aliquote Skin, so it
Aliquote
looks
Skin.
like skin. Yeah,
Ah,
yeah.
okay. And we'll put that up on the screen. And you're on Instagram. I'm sure you've got a website. All of that information
Yeah,
will put up there as well.
that's wonderful. Thank you so much, Mary, for
Okay,
having me.
thank you. Thank you for taking the time. I know you're in a busy clinic and you probably have patients waiting. Okay, we'll see you soon. Hopefully, I'll come to
Okay,
Calgary and see you with Josiah.
please do. I'm
Oh
ready
my
for
gosh,
you.
so fun. And then we'll go out
Okay.
to dinner.